My name is Sonal Oza. I'm an oncology rehabilitation physician at Winship Cancer Institute. As an oncology rehab physician, our main goal is centered at what's important to the patient, what their physical and functional goals are. And based on that, we come up with a pretty personalized rehab plan. We work really closely with our colleagues in physical therapy. We test their muscle strength. We run additional tests to figure out, well, what's causing that patient's weakness, or where's their pain coming from? Is it truly neuropathy, or is it something else? And once we have those answers, we can prescribe a pretty targeted script for the physical therapist to help really improve their function. The classic core members of a rehab team include a PM&R, a rehabilitation physician, a physical therapist, an occupational therapist, and then also a speech therapist or a speech language pathologist. There's often a role for rehab anytime along the cancer care continuum, so meaning from diagnosis to active treatment, into survivorship, or even at times when the cancer is more advanced and has spread. Our job as rehab physicians is to really help facilitate and empower patients to continue on with their treatment. I often tell our patients that no symptom or no physical limitation is too small to bring up with your cancer team. Your cancer team wants to know what's going on, and we have the resources and services here to evaluate those symptoms, those functional limitations, and really help patients get back to living the life that's meaningful to them. That's the purpose of all of this. The phrase "where science becomes hope," I think it brings that humanistic element to our care. Science is about the data and all the numbers, and sometimes I imagine being a patient, you can feel like you're being shuffled from one hospital room to a clinic room, and blood draws and infusion. But all of that serves a greater purpose of caring for the whole patient, improving their quality of life, and I think that's the hope in it, is that all of these things that our patients are enduring is so they can spend time with their family, they can go to work, they can travel, they can have that quality and enjoyment in life. And I think that's how that phrase resonates with me.